is seen in intracapsular the breast implant rupture. Then next, cadaveric spasm versus rigidity. So cadaveric rigidity is actually other name for rigor mortis. So it takes some time to establish, and you can know the time since death, and also there will be involvement of involuntary and voluntary muscles, whereas in cadaveric spasm it is the immediately occurring the spasm of that muscles. So it doesn't tell about the time, but only the manner of death, because it doesn't take any time to establish, so we cannot calculate the time, and it is occurring immediately also, so only the manner of death can be known. Regarding factory actor, you have to remember less than 14 is not allowed. In adolescents, they can work from 6 a.m. to 7 p.m. In this time, they have to work for 4.5 hours, maximum 9 hours, and in week 48 hours and 60 hours if overtime. So remember 4 9, then 4 6, okay, 4.5 9 hours, 48 60 hours. Then polio outbreak is about a wild poliovirus detection or CVDPV detection, any of those two. Then vector control in urban area is more polluted, we know. So the main control is by cleaning the breeding places, the artificial collection of water, everything you have to remove. Whereas in rural area you are giving spray itself, you can give indoor residual spray or long lasting insecticide treated nets. When you give long lasting insecticide treated nets, if annual parasite index is more than 2. Then next, the mobile medical unit means it is actually providing all the service, okay, and it is for both rural and urban areas, and it is for 10 lakh population. It is providing all the services, giving medicines. So it will be having one doctor, one MO, one nurse, one pharmacy, one lab technician, and one driver, like that. Renal pelvis, the order is anteriorly, the most anterior is vein, renal vein, then artery, then pelvis, VAP, that is the order. Pelvis, so turn it VAP, PELVVAP is the order, okay. Neurovascular bundle in abdomen is in between internal intercostal and transverse abdominis muscle, second and third layer in between that. Glycine and GABA. Glycine is mostly in spinal cord, like in tetanus poisoning, strychnine. GABA in brain, like in Purkinje cells, and also Renshaw cell and all. Renshaw cell is glycine, spinal cord, interneuron. Prostatic urethra is mainly transitional epithelium initially, then pseudostratified columnar epithelium. P-value is actually alpha error. It is type 1 error. Remember 3 terms. One is P-value is type 1 error. That is the alpha value. It is false positive. These 3 important. That means it is accepted. Okay. Whereas type 2 it is 1 minus beta. That is not. P-value is actually type 1, which is alpha. Morque's disease and Sanfilippo. We always study Hurler and Hunter. Remember this thing, that cornea clear for Hunter and Sanfilippo's. Morque's, there is no visceromegaly, there is no mental retardation, no leukocyte inclusion. Cyclical trend was secular trend. Influenza, measles, tetanus, they are showing cyclical trend. Secular trend is for non-communicable disease. Quarantine was period of surveillance. Quarantine is equal to incubation period. Period of surveillance, that is double incubation period. Side effect of diabetic drugs, gliptin are actually leading to nasopharyngitis, DPP for inhibitor. Then exenatide, that is GLP analogs, pancreatitis. Another important thing is glyphosine, SGLT2 inhibitor cause euglycemic decay. So whenever you get a question about acidosis, in that case, either metformin or think this glyphosine. First order, you have to remember T half is constant. A constant fraction is eliminated. So that means half, half, half. For example, 100, then it will become 50, then half 25, then half 12.5, like that. It is not the amount, the constant fraction. So the graph, in case of first order, the graph, if you have to read first, you have to slide fast, right? So it's like a sliding, whereas it's a straight line in zero order. Imipenem versus nelfenavir. Imipenem, you are using cilastatin only for imipenem to protect from renal dehydropeptidase, renal, okay? Whereas nelfenavir is the exception for ritonavir boosting. For all others, ritonavir is given. In imipenem, only for imipenem, cilastatin is given. Then extended spectrum beta-lactamase, the treatment is C. Both are C, New Delhi beta-lactamase. One C is carbapenem, another C is colistin. Hypercalcemia and sarcoidosis, it is because of 1-alpha hydroxylase. In squamous cell carcinoma, parathormone-related peptide. Coxa-vara, the agonist decreasing. Priapism, if it is ischemic, non-ischemic. If it is ischemia, there will be congestion of blood, right? For example, sickle cell anemia. So you can either aspirate blood, give phenylephrine, or you will have to make a shunt. But non-ischemic means you can take time, no emergency treatment. So take time, because mostly it is trauma. Take time and embolize. So a sign is hyperextension in appendicitis, hyperextension. Which chordae is in hypospadias? It is ventral chordae. Remember, ventral opening, ventral chordae, both are ventral. Neck of femur fracture and IT fracture, most severe is IT fracture. More rotation, more ecchymosis, pain, everything. More shortening. Port spine, the surgery indication. If there is neurological involvement, then only we do surgery. If no involvement, no surgery. Complication of circumvallate placenta is preterm labor. Switches in eye, we are getting in CMV retinitis. In uterus, metropathia hemorrhagica, which is a painless bleeding. Messes, remember the mnemonic ELISA, that is it is extent of injury, limb ischemia, shock and age. And Tresses, Irma. Irma is again injury, M is mechanism of injury, I is injury severity, M is mechanism of injury, then R is RTS, A is age, RTS is GRB. GRB is what we have revised trauma score. RTS, we have to revise. You again look for these things like a BP, like a Glasgow Coma scale, respiratory rate, means vitals you check again, right? That's contraindicated of hydatid cyst. Remember, in honeycomb hydatid cyst, it is honeycomb means multiple cysts, so no pair technique. Oh, I have written contraindication of pair in hydatid cyst. Then GCS2, this is a shortcut method. GCS2 for PASSE. PASSE is pain, S for that is eyes, EVM, eyes opening to pain, verbal sound, motor extension, that is 2. So that's an easy way to identify. So this is day 3 and we will be coming back again on next day, so stay tuned. Till then, bye.